Okay, so now we're going to dive into areas of emphasis for specific conditions in reflexology. This is chapter 16. This is what we've been working for. So in this chapter, we are going to go over contraindications and precautions, conditions related to the body systems, what key and additional reflexes we're going to work with our client, and then we're going to dive deep into some case studies. So the very first thing that you have to be aware of is when you do not work with a client. On page 16.4, you're going to see contraindications and precautions. Now, a contraindication is an indication against the advisability of providing a particular treatment or remedy for a specific symptom or condition. So with reflexology, there are two hard no's. We do not ever work with anybody that has a blood clot or a stroke. Because if somebody has a blood clot and we work on them, what's going to happen is it's going to get, reflexology is designed to get your body to restore normal function. Normal function is blood flowing throughout the body. If blood flows when it's a blood clot, it could cause big problems, including death. So until a blood clot has been dissolved with warfarin or whatever, a doctor has to confirm that it is safe to do anything that increases circulation. It's not enough to tell your clients to go to the doctor and see if they can have reflexology, because most doctors don't understand what reflexology what it does, and they'll say, yeah, whatever, thinking it doesn't do anything. If you increase circulation in that situation, it can be life-threatening for your client. So if somebody comes to you with a blood clot or a stroke is the same thing. You don't want to increase circulation in the brain because you don't want to trigger another stroke. You are going to send your clients to the doctor to make sure that A, they're stable, and B, it's safe for them to increase circulation. Once there's a doctor's note stating that they can increase circulation, then it's okay to work on them. But you need a doctor's note, and you need to make sure it is increased circulation is safe. Okay. Stroke clients, in most cases, you don't want to work with them until they've been stable for 4 months. Okay. Now, precautions, it's a little bit different. So we're going to work with precautions with pregnancy. If the client has acute infection or fever, hypertension, in vitro. If somebody's going through in vitro, you do not do a reflexology session on them, because in vitro is not normal. It's not, they're using extra steroids, or they're using synthetic things in order to try to get pregnant, and they're spending tens of thousands of dollars to do it. So the last thing that you want to be able to do is flush out anything that they're taking, because if they've invested tens of thousands of dollars to get pregnant using in vitro, you need them to follow that method. Once they're done in vitro, if it works, fantastic. If it doesn't, you can do reflexology before in vitro to get the body ready. But once they start taking the drugs, it's a no-touch situation. If they've got spotting or bleeding, if there's a threatened abortion, or they have a lot of miscarriages first trimester, and you or the mom is not comfortable, then you do not do a treatment. If somebody has a foot injury or an infectious condition that you don't want to touch, I mean, if somebody showed up with gangrene that looked like that foot in chapter 5, I probably wouldn't be touching it. The same thing with athlete's foot, you wouldn't want to be working on that. You can refer them to a foot doctor or their doctor to get it looked at. If at any time you don't feel comfortable doing a session, don't. It can be fear, but it can just be your instincts telling you no, and you respect that. Okay, so um, when we get to page 16.7, that gives you all of the conditions and the key and additional reflexes that you are going to work for the nervous system. So again, the reflexes associated with that are the brain, hypothalamus, spine, the peripheral nerves, which is on page 16.6, solar plexus, eyes, ears, inner ear, nose, mouth, and sciatic nerve. Page 16.8, we've got the endocrine system. Again, we work the hypothalamus. It was in the nervous system, but it's also in the endocrine system. Pituitary, pineal, thyroid, parathyroid, thalamus, adrenal, pancreas, ovaries. Remember, for every condition, no matter what it is, you are always going to be working the pituitary, the adrenal, the solar plexus, and the hypothalamus. We call it PASH, or you can call it HASP. I don't care what you call it, as long as you are doing all four of those reflexes for every client that you got with intention. Page 16.9, we go into the respiratory system. That's the nose, the sinuses, the trachea, pharynx, larynx, bronchi, the lungs, and the diaphragm. Cardiovascular system is just the heart reflex. That's on page 16.10. The digestive system is on pages 16.11 and 16.12, and it includes when we start digestion, it starts in the mouth, it ends in the anus, and in between is the mouth, the teeth, the pharynx, the esophagus, the stomach, the small intestine, the ileocecal valve, the appendix, the large intestine or the colon, the rectum, anus, liver, gallbladder, and pancreas. Urinary and renal systems, that's on page 16.13, and it is the kidney, the ureter, and the urinary bladder. Page 16.14, you got the immune system and the conditions. It's the groin lymph, the lymph nodes, the lymphatic drainage point, the spleen, the tonsils and adenoids, and the appendix. The reproductive system you're going to find on page 16.15. It includes the ovaries, testes, fallopian tube, vas deferens, the uterus, prostate, vagina, penis, breast, pituitary, hypothalamus. The musculoskeletal system you're going to find on page 16.6, and it includes the neck, neck and shoulder ridge, shoulder and shoulder joint, or the axilla, otherwise known as the armpit, your arm, leg, jaw, knee, thigh, hip, hip, lower back, chest, ribs, and spine. Remember that the spine is divided into the cervical, which has 7 vertebrae, the thoracic, which has 12 vertebrae, the lumbar, which has 5, the coccyx, which is fused 1, and the sacrum, which is fused 1. Okay. And we always have to remember to work the referral reflexes when applicable, and you can find all of those on page 27. So a treatment plan, it's going to be the key. What are the key systems that you're going to be working, and then what are the additional? And you can see when you look at here, okay, when I work on this client, I'm going to see the brain reflex, see if there's anything tender in the brain reflexes, the eye reflexes, the hypothalamus, the pituitary, the thyroid, thymus, esophagus, diaphragm, solar plexus, large and small intestine. We got stomach. We got spleen. We got pancreas. We got liver, gallbladder, large intestine, rectum, sciatic. We got ovaries, testes, fallopian tube. So we got the reproductive system in here, as well as the whiplash point. Okay, so again, your treatment plan should look like this. Everything on one foot. After you do the very first session, all that you're going to see on one of these sheets is whatever the client told you. So that's going to be what you saw for foot conditions and what you have discovered from what they have told you. So for example, you're going to have a blank one of these. and all that's going to be on it might be, I pressed on the thymus and it was a 2. So you would just have a number 2 right here. Or if you pressed on the pituitary and it was a 6, you'd have a 6 here. You hold it for up to 15 seconds. Did it get less? So if it started at a 6 at the pituitary and you held it for up to 15 seconds and it went down and it felt like nothing, it would be a 6 to a 0 right here. And I mean, if they got dry feet or whatever, it's however you mark it on your glossary of symbols. So you'll have one treatment, or you'll have one sheet that looks like this with the feedback from your client and foot conditions after the first one. When they leave, you are going to go into your health record and you are going to create a treatment plan. And so when they come back for their second session, you are going to use this treatment plan to start trying to get feedback from your client, or to train your thumb on where you need to be pressing. So is it crunchy? Is it tight? Is it lumpy? Is it soft? Is there tenderness there? There's so many questions that you can ask when you can figure out where this is, because your first reflexology treatments, you are not going to be an expert. You're not going to have a clue what you're feeling for. You're not going to have a clue what questions to ask. And that's what this treatment plan was designed for. So the purpose of the treatment plan is you always do a full reflexology session on every client. So why do we need a treatment plan? If I had a dime for every time I was asked this question, you will have clients that fall asleep or do not give you feedback on a pain scale. By knowing what reflexes you should be focusing on to help your client's body, you can make sure you are on the correct reflexes. Clients are also going to test you to make sure that you know what you're doing. The treatment plan will help you ask relevant questions that will increase your credibility with your clients. And with that credibility brings trust. It also brings a ton of referrals. So when a client trusts you, they are going to relax. That takes them deeper into parasympathetic mode. They happen to get results. When they get results, they tell everybody, and then your practice is full. That's why you do a treatment plan. So right now, what we're going to do is we are going to do a case study. And Henry is 56. He just booked a foot reflexology session with you. He's a construction worker that has been working long days. His feet have been painful for the past month, and he's got a 10 on the pain scale for his feet and his back, and he has been referred to you by one of your previous clients. He will do anything to try to get some relief. Now, on his health record, it shows that Henry is not sleeping. He's had hip pain for 3 years. It's at a 10. He's had knee pain for 2 years. It's also at a 10. He has lower back pain because he was in a car accident when he was 18 and has had trouble with it since. Note, he's 56. It's also at a 10. He's got high blood pressure that he can't get under control, and he has frequent headaches. So what I want you to do is go into your health record. You just make up whatever you want to in the address part, but his name is Henry. I want you to fill out the not sleeping, the hip pain, the knee pain, all that kind of stuff on both sheets. Everything else is a no. And then what I want you to do is, with that health record, I want you to take that information and put the key reflexes and the additional reflexes that you would be working for Henry on one of those treatment plans. You're going to create a treatment plan for Henry based on this information that you have been given, using the information from page 1617 all the way to 1614. So you're going to go in, you're going to find sleep disorder, hip pain, knee pain, back pain, high blood pressure, frequent headaches. You're going to find out what the key reflexes are, what the additional reflexes are, and then when you have that, you are going to put those reflexes on a treatment plan. So in a glance, you are going to know what you're going to work for Henry. So now we're going to do one more case study, and this is going to be Sarah. She's 23. She has just booked a foot reflexology session with you. She's an office worker that has been dealing with office drama and problems with her boyfriend. Her wrist and shoulders are aching, and she can't get any relief no matter what she tries. She's an 8 on the pain scale. She has been having extreme cramping with her periods, and she's also been having some bouts of depression. So the biggest challenge on her health record is not sleeping, shoulder pain for the past 3 months. Again, it's at an 8. Her wrist pain has been going on for about a year. It's an 8. She's had PMS for 10 years. It's at a 10. And her depression has been spiking for about the last 6 months. And she rates that as an 8. So what I want you to do is take another blank foot sheet and just using chapter 16, find the key and additional reflexes for this case study.